Okay, let's have a look at the angle lambda, which is possibly one of the least understood and least applied measurements that we can take. So we've got a map of a fairly regular eye here, and let's take off the color image to start with. Now what we can see is we've got the placido rings are finishing about here. I'll just highlight them so we can see exactly what we're doing. So that's where the placido ring image ends. And if we define the iris, what we can see is that there's a bit of a gap on the right hand side and there's a bit of a gap on the left hand side, and that's around about equal, which is quite good. Of course, if we fit a soft multifocal lens or if we fit an ortho-K lens, what's going to happen is the lens, which because they're quite large, are going to generally sit in the center of the cornea. The patient, if they're looking at the middle of the circles, we've got the visual axis is in the middle of the placido ring, so we can tell whether there's a discrepancy between the middle of the cornea and the middle of the visual axis, and that's what we're looking at when we talk about measuring angle lambda. So if we click on the HVID, we can see that the purple cross is pretty much right on the fixation. So we can see that there's almost no measurement of the angle lambda in this patient. So this patient is a really good candidate for any of these complex visual optics from concentric lenses, so 0.1 millimeter. So that's a good candidate. The lenses are we expect the lens to center. Let's have a look at some other examples. And if we look at this example, we can see that, let's have a look at this one. So this one, we've got a bit more of a discrepancy. So again, we can see that the Myers from the placido ring is finishing here. And on the right-hand side, we've got a gap on the cornea. On the left-hand side, there's no gap. And then the iris, which is defined here with a cross for the iris, is this cross here. So this gap, this yellow line is the measurement. Let's put a ruler on there so we can see from the middle of fixation to the middle of there's about 0.65 millimeters, 0.66 millimeters. So that means that the optics of the lens are going to be decentered by 0.66 of a millimeter. And that's reasonably large. A typically small measurement will be up to about 0.3 of a millimeter, up to about 0.8 is tolerable for a lot of patients, and over 0.8 is going to skew the optics, particularly in higher prescriptions, whether it's higher ortho-K or a higher add on multifocals, just because of the decentration. And it's not a decentration that the lens manufacturer can do anything about, because it needs to be asymmetrical effectively. You can't decenter the optics on a contact lens. So that's the angle lambda, and that's the implications that it can have on ortho-K and soft multifocals. So I hope you found this video useful. Check out our other videos, including the other ones in this series on topography.